Hello, everyone. My name is Marty Guthmiller, CEO at Orange City Area Health System, bringing you another special edition of our community briefings relative to COVID. And you'll see on the screen today that I'm not alone. I have Randi Sayles, one of our clinical pharmacists, who's with us today to walk you through some of the requirements or recommendations for boosters, who gets them, that type of thing. What I wanted to say is this stuff is kind of late breaking. It's just happening, and we thought it'd be best to just do one of these briefings and let you know. We are taking appointments currently in the clinic at 737-2000. If you would like, you could get your flu vaccine and your COVID vaccine at the same time. So that's up to you, but you can do that if you want. We are going to do as many boosters as we can, and as soon as we can. It's not particularly an urgent thing, but we surely recommend that. We do have plenty of vaccine available also, maybe 250 Johnson & Johnson and probably 700 Moderna, but those are full dose Modernas, and so the dosage for the booster is about half. So we have 1,500 doses of Moderna available. So what I want to do first, though, is share a screen and talk about why we are pro-vaccine and anti-mandate. Pro-vaccine, you can see this is on October 19. I used this image the other day. This is on 22 Sanford Health owned hospitals. You can see 219 hospitalized, 198 of those 219 were unvaccinated, 21 were vaccinated. So it's not bulletproof, but it certainly helps. When you drill down a little bit more into that, you can see that there are 54 in the ICU in Sanford owned facilities. 52 of those 54 are unvaccinated and 2 vaccinated. And then further, the sickest of the sick, the 41 on ventilators, 40 of those 41 were unvaccinated, with only 1 being vaccinated. So we really strongly recommend being vaccinated, as we have all along, and also subsequently now receiving the booster. And so I'm going to turn this over to Randi, and we're going to call this flowchart up on the screen. How does that look, Randi? Should I maybe increase it one more time, or? That'd be okay, yeah, if that works. There, we'll do that. Okay, and I believe you come up with this flowchart, Randi. Is this your doing? Yep. Yep. Right. Good. All right, so we'll let you go ahead and explain it, and we'll probably have this on our website too, so that folks can follow along. But we thought we'd go through this right now, maybe save you from calling in to ask questions about, am I eligible, am I not? So hopefully this helps. Randi, it's all yours.
All right, so last week, the end of last week, we got the go ahead from the FDA and the CDC just giving boosters to patients. A lot of people know that the Pfizer booster was approved previously, but a lot of our patients received the Moderna or Johnson & Johnson vaccine. So a lot of our patients at that time didn't qualify, but now the FDA and CDC has made some new recommendations. So we made this flowchart to kind of help our clinic staff know who qualifies and what should be done. So if you look at that, the first question is, what vaccine did the patient first get? So if you look towards the left, you'll see Johnson & Johnson. The CDC and FDA came out and said a booster dose can be given to people who receive Johnson & Johnson at least 2 months after the initial dose. So remember, Johnson & Johnson was just a 1-dose vaccine. So people got 1 dose, whether it was back in February or March of last year. As long as it's been 2 months since that first initial dose, you would qualify for a booster. And the booster can be any of the vaccines. So if you got Johnson & Johnson first, but like our clinic offers, or we have more Moderna doses, you can use Moderna for your booster if you want to. As long as you're 18 years of old and 2 months out, you can get a booster shot. So that's the Johnson & Johnson route. And then if you go to the right, you're going to look at Moderna and Pfizer. Those are mRNA vaccines. The first question there is the patient immunocompromised? Immunocompromised patients actually were approved for a third dose previously, so not just last week, but before. So we have been giving some immunocompromised doses. You'll hear me say either third dose or booster dose. And there is a little bit of a difference in the terminology there. So a third dose is a dose that we're going to give to an immunocompromised patient who may not have mounted an adequate response to the first 2 doses that they received. So if they're on like an immunosuppressant or a medication that suppresses their immune system maybe didn't get that adequate response from the first 2 doses. So if they're immunocompromised, they would qualify for a third dose, and that's 28 days after the second dose. The third dose is a full dose. So as we get to booster shots, we'll talk about one of the vaccines is not a full dose. So the third dose is a full dose, and it's 28 days after the second dose. So that timing is different than boosters as well. So immunocompromised patients, third doses, and their full doses, and they're 28 days after the second dose.
So Randy, would this be a good time to take a look at what that means?
Sure. Yeah.
We'll go down to, just as an example, I'm going to try to move this over a little bit.
Yep, that sounds good.
There's a couple, this helps people like me.
Yeah, so who is immunocompromised? They did give us, guidance on who would qualify for immunocompromised conditions. Patients that have active cancer and they're getting treated with chemo treatments, they're going to qualify. If they've had an organ transplant, a lot of them are on medications to suppress the immune system, so they're going to qualify. Or a stem cell transplant within the last 2 years. Certain medications will kind of suppress or bring down the immune system. For example, medications for Crohn's, multiple sclerosis. So those are some of the big ones that we see. Some of those medications suppress the immune system a little bit, and those patients would qualify. If you have a question about whether your medication is an immunosuppressant, you can always call in and we can review that. Myself and Amy, we're clinical pharmacists, and we get these questions and we'll just review and see if you were to qualify as an immunocompromised patient.
Great.
So, and then the other one we see a lot of questions about is that steroid. I'm on steroids, does that qualify me? So typically high dose steroids, it's going to be long-term steroids, not just a burst. So sometimes people get like a 5-day treatment of steroids. It's going to be longer treatment, and prednisone is the most common one we see. So 20 milligrams or above of prednisone would qualify you for the immunocompromised conditions. So that's a common question we get, is how much prednisone qualifies.
Okay,
so those are the immunocompromised patients. So if you're not immunocompromised, this is where the new information came in last week, at least for our Moderna patients. So we're not immunocompromised, but we are 65 years of age or older. Remember when we started giving vaccines, that was that first subgroup of people that got vaccines, was people 65 years of age or older. So if you fall into that category, you do qualify for a booster, and that would be 6 months after your second dose. So if you got your doses in January and February, then you're already 6 months out from that second dose in February. So just kind of look at when you got your second dose and make sure you're 6 months out before you try call and schedule that booster dose. What if you're not 65 years old? So they also gave us guidance for patients that are 18 to 64 years old, but they might have another condition or work in an area that puts them at higher risk. Those patients also would qualify for a booster, and that would be, again, 6 months after the second dose. There's a lot of people who do fall into this category. So if you think of healthcare workers, they're going to qualify because they're in.
I think we have a list of those here too.
Yep, we do. So first responders, teachers or education staff, food and agriculture workers, which is a lot of patients in our area, manufacturer workers, correction workers, U.S. postal workers, transit workers, and then grocery store workers. So if you're 18 to 64 and work in one of those settings, you would qualify for a booster dose 6 months after your second dose. Or if you are 18 to 64 and you have medical conditions. So if you scroll down for those underlying medical conditions, cancer, chronic kidney disease, lung diseases, dementia, diabetes, there's a large list of them, but we'll have this available. And if you have a question, if you qualify, give us a call. But there's a lot of people who qualify into this underlying medical conditions area. And just a quick point on the dosing. If you're getting a Moderna booster, they approved half of the original dose. So 0.25 mLs or 50 micrograms. The Pfizer is a full dose, which is 0.3 mLs. So that is a little bit different. And so our clinic has the Moderna, so we will be giving that 0.25 ml dose of the Moderna vaccine.
So just to recap, if I'm 65 and over, green light, go, I can get it whenever I get scheduled. If I'm
As long as they're 6 months out.
As long as you're 6 months out. If you're 18 to 64, you need to fall into one of a couple criteria, medical conditions, or most likely occupation would probably drive you into that. And if you don't in any of those areas, then no booster is recommended at this time.
Correct.
Okay.
The Johnson & Johnson vaccine does not have those requirements. So if you got Johnson for your first dose, all you have to do is be 18 and 2 months past your first dose. There's no extra requirements for that.
Okay. All right. Clear as mud. No, this is actually very helpful. We're going to post these on our website. Again, you can take a look. You can watch this on our YouTube as well. And hopefully this helps. Again, if you have some questions on your medication, you can call and ask for Randy or Amy. They'll help you through that. Again, our triage area is ready to go. And again, 737-2000 will get you an appointment for either a booster and or flu shot. Randy, thank you. Is there anything else that you would need to add at this point?
Nope. I guess the other, I think we did talk about it, but if you got your Pfizer as your initial series, we can give you your booster here with Moderna.
Okay.
So.
Very good. And then the other topic that's out there that we're still waiting for some guidance on is pediatric vaccinations. And so, you can stay tuned for that information as it becomes available, but we don't have anything worthy of bringing to you at this time. Okay, well, hopefully someday we don't need to do these briefings, even though they might be special briefings. So, but we thank you for joining us today. And Randy, again, thank you for putting this information together. We greatly appreciate it.
Yeah, thanks.
All right. Thanks, everyone.